Hello, everyone. Welcome to the Unleash podcast brought to you by Hidden Gen, where we talk about how to unleash your hidden potential. I'm your host, Yuri Diogenes, and we have a great episode today feature Dr. Alex Williams. Thank you very much for being here today, Dr. Alex.
Thank you. Thank you for having me.
Absolutely. Before we jump into today's topic, we would like to invite you to subscribe to the podcast on YouTube, Apple Podcasts, or Spotify. You can also find this podcast at Hidden Gin website, hiddengin.net. And if you live in the area and you have not been at Hidden Gin, you can always grab a free trial pass at hiddengin.net. All right, so let's get started here, Dr. Alex, which is also known as Dr. Rocket. So, first question is, what does Dr. Rocket come from?
So the nickname Rocket came from when I was about 5 years old, playing Little League football. Actually, I was the fastest person on the team. And at that time, the Dallas Cowboys had a receiver by the name of Rocket Ishmael on the team. And so the coach kind of took that first name and kind of mixed it and nicknamed me Rocket. After that, it just kind of stuck with me throughout my life. And here we are now, some odd years later, and it's still there.
And you still fast.
Say it again.
And you still fast. Not as much.
I like to think so,
Yeah.
but yeah, it might. I was faster in the past for sure.
Absolutely, absolutely. So you are you work on recovering, right? So I would like to start talking about this topic. I
Okay.
think that the first question that I have around this topic is how important it is the recovery process throughout the longevity of an athlete.
So it's very important. It's essential. I think a lot of athletes will tell you how vigorous it is for them training wise, and to have their body be able to perform at a elite level in order for them to achieve their end goal. And a lot of elite athletes, especially here in the recent past, when you have stars like LeBron James and Tom Brady, who are playing into their later years and able to do so because of how well they've taken care of their body through the recovery process.
Mhm. And what type of recovery do you do?
I'm a chiropractor.
So some of the specialties that you have, for example, you do also do soft tissue work as well.
Correct. So we do, of course, you have the adjustment, but we also do as far as working with muscles, fascias, tendon, and ligaments. So we do soft tissue such as active release technique, just kind of help alleviating tension. In that toolbox, we have things like cupping as well, dry needling, along with corrective exercises to kind of help with correcting posture and all of that good stuff.
How's this activation works?
So the active releasing technique. So what do is you take a muscle and you find its tension or its lack of action, and you pin it and move it in a certain direction in order to help stretch it out or help alleviate that
So
tension.
it's like a massage.
Similar, very similar.
It's
Yes,
like
very
it's
similar.
like that deep tissue massage, similar.
Correct. It's like a more isolated massage for sure. Yeah.
Okay. And what is your take on cupping? I know that you use, but there is a lot of controversial around cupping. If you,
Uh-huh.
what is the science behind the cupping?
Okay, so you have what's called an indirect response, and then you also have a direct response. So if we take the direct response first, whenever you're administering cupping, you're stretching out the muscle or alleviating the tension, very similar to if we was to do active release as well. So you're getting your direct goal is the same thing. You want to alleviate muscle tension.
Hmm.
After that, then you're looking at more indirect things. So by alleviating that muscle tension, of course, muscles are innervated by blood vessels, arteries, and nerves also to help supply the muscle. And so you're able to kind of take out the kinks of what's feeding the muscle. So if I had to give an example, it would be like stepping on a water hose. You know, you step on a water hose, there's no water coming out of the water hose to water the grass.
Hmm.
And that pressure starts to build up in the water hose. Same thing with a tight muscle. That pressure starts to build up behind the muscle because it's not able to act or activate properly like it's supposed to. And so you decompress that soft tissue, muscle, fascia, whatever it may be, and you start to get more blood flow. You start to get better activation from the nerve. So now that your mind muscle connection is enhanced or functioning optimally, so that your muscles are able to perform the way that they should.
Got it. Very interesting. Now there are for different type of athletes. I'm assuming that there'll be different type of recovery, right? For example, bodybuilders, they do have different needs that a sprinter or
Correct.
so what is usually the pattern that you work on those athletes? For example, let's
Okay.
start with bodybuilder, for example.
Okay, so for bodybuilders, the first thing I want to know is problem areas. What areas in the gym are we? Because we all have them. Whether you're a bodybuilder or not, if you work out, we all have those areas in our body that are just weaker or they don't function as well as they should or as well as other areas. And so the first order of business is figuring out what are those areas because that's what we want to target.
Hmm.
That way that athlete is getting the best out of their workout. You know, as a bodybuilder, your main focus or your main goal is the look of your physique. And so being able to activate and use those muscles properly is going to be a huge thing. The next thing in the bodybuilding world is also going to be posing. You got to be able to pose and pull those muscles out. And so I would then go from gym wise, what are we working on? And then, okay, how are we with posing? Is there any restrictions? Have you noticed whenever you try to activate a muscle to kind of pull it out so that it can be seen? Is that working for you? And then also you want to go symmetrical on both sides. Is one side easier to pull out than the other? Is one side bigger than the other, you know, for inactive muscles? Then you want to correct that process as well. So the end goal is getting that athlete on stage full and able to pose however they have practiced their posing.
Do you do also a lot of stretching for them, or is not really their target?
Oh yeah, definitely do. Stretching plays a huge factor, and that is one of our services that we provide here as well. Yes.
Because I know, for example, for BJJ practitioners or MMA fighters, stretching is extremely important.
Correct.
So, what do you do usually for this target audience? Like, let's say, a MMA fighter or a BJJ practitioner that goes. Usually, you start with stretching, or you also will target it with the same approach, looking for the areas that are bothering the person.
Correct. So same thing, same areas of concern. If there's any nagging aches or pains that have driven this athlete to me, of course, we want to address that. But also as a chiropractor, and whenever we're adjusting the spine or extremities, we also understand that muscles are connected to the spine and those extremities. And instead of kind of pounding through the tension of the muscles, we want to alleviate that tension by stretching those muscles out before we go into the adjustment. Otherwise, you just have that constant pull on the joints and extremities, causing for the misalignment over and over again.
One thing that is very common, I think, for not only for bodybuilders but also for MMA or BJJ practitioners, elbow problems. I personally have tennis elbow. It's really tough because it's an ongoing issue. Do you also deal with that?
We do. We definitely work on elbows. And the key point to elbows, which are very similar to knees, is it's a stabilizing joint. And so in understanding that, basically it's stabilizing your wrist and your shoulder. So your wrist and your shoulder is going to be what's considered your mobile joints, and then your elbow is going to be what stabilizes the two. The problem is the elbow only does what the wrist and the shoulder tells it to. So if you start to lose mobility in the wrist or the elbow, or I'm sorry, the wrist or the shoulder, then there goes the elbow as well, and you may start to feel some aches and pains in that elbow.
Oh, that's very interesting
Hmm.
because that
Hmm.
actually happened to me. I started losing mobility on my wrist, and now my
Hmm.
elbow is hurting.
Yeah, 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 yeah.
So the goal is to fix the wrist so that the elbow gets better, or you also work directly on the elbow?
Both. So you always want to correct the problem. However, the I guess the difficulty of correcting the problem is going to be pain based, right? So if we're feeling a lot of pain in the elbow and I go straight to the wrist, we're not going to be able to do much. So we got to get that pain management down or that aching down in the elbow, and then we can start correcting what's actually causing the aching in the elbow.
Okay, that's cool. That's cool. And you call this stability work?
So this is what's called corrective therapy.
And what about stability work? What do you consider stability work?
So as far as stability work, which also is a part of corrective exercise, because you want to stabilize joints that are meant to be stable,
Hmm.
right? Like we're talking about the elbow or the knee. And so there's different movement patterns that we can do that will help stabilize those areas. There's different movement patterns that we can do to help increase mobility in the joints or areas that should be mobile.
That's interesting. And for someone that is looking to this, usually you recommend 2 sessions a week,
Mhm.
1 session a week. What is a good pattern to follow?
So it's gonna vary, especially for my athletes. I mean, you're as athletes, you have what's in season, and you also have what's out of season or what's off season. And so it's gonna depend on, again, vigorous of training, how hard we're going. And so a good rule of thumb to take is, if I had to just give a roundabout, I would say if you're training anywhere between 3 to 7 days a week, um, I should at least see you once a week at the very least.
Hmm.
And that's if we're only focused on like preventative or maintenance. That's not if you have an injury or something nagging or a condition. Then obviously I would need to see you more than that.
Okay,
Mhm.
interesting. What is your advice, not only on the recovery that you do, but do you also prescribe like some homework, like
Oh yes.
for people to do on their own? Because sometimes it's hard to be
Mhm.
at the doctor like twice a week or once a week.
Correct.
So you
Correct.
also give some homework for people to do on their own.
Oh yes, I tell my patients all the time. What you do away from me is going to impact what we do here, or in the clinic. And what I mean by that is you're going to be there more than you're going to see
Right.
me. So there's definitely going to be foundational keys to the prescription that we're given in order to help correct not only what we're doing here, but also correct what you're doing outside of the clinic that may be causing a lot of what's going on.
There is a lot of debate around stretching before a heavy lift, a heavy workout. Some people say that is not very optimal for
Mm-hmm.
lifting. What is your take on that? Do you think it's important to always stretch before any lift, or there are that depend on what you're gonna lift or the how heavy you go?
Right. So going into the lift, it's more important that that muscle is activated. It's awake. You have some type of blood flow kind of already going to that area, and so that's more. You want to do more warming up, so more ballistic things, so more movements versus just static stretching. However, when you are working out, when you're lifting that heavy weight, you're contracting that muscle in so many ways, so you're shortening that muscle, and so it's going to be more beneficial for you to stretch after you work out because you've just broken down and shortened that muscle.
Hmm. And what can you define? Because I hear this terminology a lot. Active stretching. What it is actually active stretching?
Okay, so whenever you hear the word acting, that's going to be going back to what we were talking about as far as ballistic. So that's going to be movement. So not just static or holding a stretch. You're actually moving into the stretch. slowly, not, not speed wise or not, just kind of pounding the muscle, but you're kind of taking that muscle and saying, okay, this is the action of this muscle. And so we're going to go slowly stretch into that action
Do
versus
you
just
have an
kind of pulling
example?
at
For
it.
example, if I'm going to lift, let's say, arms, like I'm gonna work out biceps. So what will be an
Mhm.
active stretch for arms?
So you could do something as simple as using bands
Mm-hmm.
and just kind of doing band pull aparts, internal, external rotation of the shoulders, because you're going to be using the shoulders if you're doing arms, or internal, external rotation of the wrist, because you're going to be using the wrist if you're doing arms. Then those are your two mobile joints. Going back to what we were talking about earlier, as far as what's mobile, and then versus what's stable. If you solely focus on, just to kind of answer your question before, if you solely focus on the static or the pull stretch, that can lead to other things like elbow problems, elbow pain, and becoming less stable in the elbows because you're pulling, pulling, pulling.
Yeah. Same thing. I would imagine that same thing for a heavy legged day. You can
Hmm.
basically warm up with bands, and that is already considered an active stretch.
Correct. Correct.
Okay. And do you have like a timeline or for how long you should be doing that active stretch? Like 5-10 minutes maybe, or a little bit.
So a good rule of thumb I'll always say is, you want to, I call it, get the juices flowing, but really you should have some type of sweat. Heart rate should be going once you get into your active lift. I know a lot of people are or will go into their lift and they're not even sweating, and they're not quote unquote warmed up, right? So you want to
Hmm.
warm up, but you're not warmed up if you're not even sweating yet, right? So you got to warm up before you actually get into your active lift to get the most out of your workout.
Yeah, this is a very important a point because, for example, for BJJ practitioners that go to a tournament,
Mm-hmm.
sometimes
Mm-hmm.
you are waiting for your time to fight for a
Mm-hmm.
long time, and you really don't know what time it's gonna be. And
Mm-hmm.
I've seen a lot of people enter the mat without a proper warm up, and then they pull something.
Correct.
Uh,
Yep.
it's incredible how important it is to do this warm up before going straight to a fight.
Mm-hmm.
That's why box athletes, for example, when they enter the ring, they are already fully sweat.
Full of sweating. Yes, exactly. As they walk through the tunnel, they're already have a sweat on. Exactly.
Yeah, that really prevents injury. That's for
Mm-hmm.
sure.
Yes, sir.
So that the advice will be the same. If you are able to sweat in 10 minutes, good. But if
Mm-hmm.
not, keep pushing a little bit more.
Correct. Correct. You got to get the good rule of thumb is get that. So instead of focusing on time, focus on your body and how it responds. So if you're starting to get some sweat going through your warm up, then you know you got a pretty good warm up going on.
But from that perspective, what is your take when people do that, but they actually go to like a elliptical machine, right? And they start to warming up on the elliptical. Is
Mm-hmm.
that effective, or does it do the same thing or not?
Well, it can be. If you're, because the elliptical, you're using your arms and legs, right? So depending
Hmm.
on your style or your goal of training for that day, if your goal is to lift, do a heavy bench press, then that elliptical for your warm up is may not be the best or the ideal warm up for you. Now, if your goal for the day is to sprint 100 meters, then sure, that elliptical will warm you up to be able to perform that way.
Okay. But I guess that if you are going to, for example, train chest and you want to do a heavy chest day, elliptical won't be that effective because you are not doing anything on your chest at that point.
Correct. Correct.
So it's better to do some bands warm up for the chest, so you can
Right.
have all that blood flow on that area in particular.
Correct. You want to warm up the area that you're calling to perform for that day or that training session. or even that competition. I mean, you want to warm up. You go linking back to bodybuilders. When they're behind stage, they're warming up. How? By posing. So once they go on stage, or even by pumping iron. So once they go on stage, the blood flow is going. They have the pump that they need, and they're able to pose in the way that they have been instructed to do so.
Yeah, but for example, for BJJ practitioners, we do a lot of warm up, static warm up, static stretch actually,
Right.
which I think is not a big deal because we are not gonna lift heavy. We just need to be flexible
Correct.
at that point.
Correct. So the fibers that, or the the mechanism of performance that you're calling up on is going to be different. So that definitely is going to dictate your warm up as well. Correct.
Do you also do that dry needling?
Yes, we do dry needling as well here.
And the dry needling has the same fundamental behind, or the same idea behind the cupping, because you are causing inflammation. Is that the same thing?
Correct. So both with cupping and dry needling, you're creating what's called micro traumas within the muscle, bringing blood flow to the area to heal and correct the tension in the muscle. I personally use dry needling more for trigger points to because I've noticed it's a faster response. But needless to say, both of those, yes, there are tools that can be used to do pretty much get the same goal or the same outcome. You'll have some patients may respond better or get a better outcome with cupping. Some patients may get a better outcome with dry needling. Some patients, it don't matter what you do, they just need something. And so you'll get an outcome regardless of what tool you use.
Or some patients will need like those injections that you apply directly on the area that I heard a lot. I can't remember the name of that injection. It's based on blood cell or something like that you inject.
Oh, okay. PRP, correct.
PRP, yep,
Yeah,
PRP.
correct. Yep.
Because the PRP will be basically the same thing, but in a huge dimension because it's really target on that area, right?
Correct. Not only that, but it also it's you're using a source. So with dry needling, you're not necessarily putting anything from out of the needle into the body. Sure, the needle goes into the body and it's working with the muscle and everything that innervates. But with PRP, the actual injection, you're actually injecting something into the body. Correct.
Mm-hmm. The dry needling has, because I've done in the past, and I thought it was very similar to acupuncture. I mean, even the needle looks like it's the same.
Mm-hmm. So the needles are similar. The technique is different. So with acupuncture, you're looking at more of a systemic response, whereas dry needling, you're looking for more of an isolated response within the musculoskeletal system itself.
And I heard that dry needling, the needle actually go deeper. Is that correct?
It can go deeper, yes. On certain areas of the body, it can go deeper.
Wow. Yeah, that's painful. Because the acupuncture is very superficial.
Correct.
And I remember when I did the dry needle, it was a little bit more painful. Not as much, but I felt, because I did on my elbow, so it was not really a good experience. And and when I did with those needles that you connect to a circuit for like little pulses.
Yeah.
Do you use the same thing?
We don't have the pulse, but I do have experience with exactly what you're talking about, and you kind of get the muscle jumping and all that good stuff.
Yeah. Mm-hmm. All right. What else do you do at your facility?
So I know we went over corrective approach. We went over adjusting. We went over active release. Went over cupping. Went over dry needling. Of course, we have our massage gun, which everyone has one of those nowadays.
Everyone has one of those, but not everyone knows how to properly use.
Correct. That is correct. That is correct.
What tip can you give to better utilize that machine?
Okay, so the first thing is understanding the heads that go on the gun. I see a lot of people using like for example, the two fork
I
portion of
never
the gun.
understood the two fork. I have the two fork here. I never use it.
Yeah. And so that's actually used for the muscles surrounding the spine. And I've seen
Oh.
people like using it on their shoulder, and it's like, wait, that's not for that. Or you'll have there's the long head, the pointy head, which is actually used for deep tissue for bigger areas. So like
Hmm.
your glutes or your quads or your hamstrings, not necessarily your neck, you know. But
Right.
I've seen people use the pointy piece for the neck, you know. So yeah, the first thing is going to be understanding the pieces or the heads that come with the gun.
And
Which
I think also the speed, right? Because sometimes if you go too heavy in some areas, it will actually hurt.
correct, you can actually injure yourself if you're at like a level 4 out of 5 speed, just kind of drilling it into one area. Time is going to be a good thing, or it's going to be an important thing to know. Because you can drill an area too long and overactivate that area and cause neurological problems or even muscular problems.
Wow.
Hmm.
Oh, yeah, this thing should come with a better user guide because it's yeah, because I've seen also people using in very different ways, and I was always skeptical to try to understand at least how to utilize it. Timing, as you said, is very important.
Correct.
The speed and the heads,
Hmm.
right?
Correct.
And just to make sure that our audience knows, your facility is inside the hidden gym, right?
Correct. Yes.
What is that a special deal for members, or how that works?
Yeah, so we part of partnering with Hidden Gym, members do get a certain rate coming
Hmm.
in. Of course, just kind of saying, you're part of home, you're part of us. But also, members from outside are also not excluded from coming in. So if you don't have a membership with Hidden, you can still come in and see us.
But you have to go to the website and schedule the appointment, or have to call you guys. How that works?
Correct. So, website, social media, email, and phone number. All
So
four.
what is the website?
So the website right now is
Hmm.
ignitehealthandwellness.com.
And on social media, you are on Instagram.
Yeah, and then on Instagram, our name is Ignite Health and Wellness as well. And then as far as the phone number, it's 361-491-1321. All avenues are accepted.
Do you also do those fascia stretch type of thing?
So we don't personally do that, but there is that service here in Hidden that is performed, and we definitely refer to those practitioners or those FST instructors as well, because that
When
works. That
Yeah,
works huge for
that
what
is
we
what
do.
I try to understand. Where
Hmm.
do you hand over
Hmm.
from what you do and you say, "Hey, you know what is actually beneficial for you to do this"?
Hmm.
Which scenarios you usually do that?
Hmm. So what we provide is, when it comes to stretching, what we provide is more of your fundamental basic stretches that you should already be doing. But if you come in and you're tight or you're tense, we have to perform that. Now, if you're someone who has chronic tightness, no matter how much you stretch, you're still tight. Um, Obviously, you're going to have a little bit more time, or get a little more time spent on stretching. And so at that point, we would want to refer out to one of our FST providers here at Hidden.
Okay,
Mhm.
okay, that's good. Um, the bulk of the of your clients that visit you, what is the most common issue that you experience over the years that they have? Is it neck?
Um,
Is it neck? Is it back? Is it shoulders? Or what is usually some of the common cases that you have?
I would say it would be three. It would be low back, shoulders, and neck would be the most common that we see. Um, shoulder.
I think neck is probably one of big ones, right? Because most of the people work on the daily basis, looking at the computer, so they are all like curved.
Correct. Posture, how we sit, how we sleep, uh, looking down at the phone all day long, or looking
Oh
at the
yeah, that's
computer all
true.
day long.
Terrible,
There's
terrible.
a lot of and it's also one of the common places where we hold our stress, right? When we're sitting or standing, that's where gravity is pushing us down onto the ground, right? So there's a lot of stress that are built up into the upper back, neck, and shoulders as well.
Yeah, I always, before visiting chiropractor for the first time, I was always skeptical when they were trying to, adjust my neck. It almost feels like it was breaking my head, right? It's scary for many people, and I had to do this multiple times to get more comfortable.
Mm-hmm.
Do you also have this problem? People are too tense when you are trying to adjust.
Oh,
because people have to relax, otherwise you're not going to be able to adjust.
Of course. And so one thing that I've found that's helped for me is understanding where that fear comes from. Because it's either one of two things. Either you fear the noise that you're going to hear, or you fear, like you just said, someone's taking your head off. Yeah. And so if I can educate in a way that you understand what I'm about to do before doing it, then usually that kind of helps that person kind of relax. And so I always tell them, especially if it's their first time, to relax. If we're stretching, hey, just relax, because I'm not adjusting yet. I'll let you know when I'm going to adjust, because as soon as you lay them down on their back and you start to, feel around their neck, the eyes get wide, the ears, everything just goes. So you definitely have to ease into it for sure.
Yeah. And now one last question before we wrap up. Is it better that the noise is louder, or it doesn't really matter? Because sometimes the doctor is adjusting you and we don't have any noise, but sometimes we have a big noise. So what's the difference, and what is better?
So the first thing is, let's understand the noise itself, right? Because a lot of people have the misconception that the actual popping noise that you hear is the bones popping.
Right.
It's not actually the bones popping. So when you have a misalignment within a joint, that joint, your body adapts and it puts something in place of there. And so that substance that's put there is what's considered gas or toxins in the body. So it's very similar to opening a can of Sprite, right? You open a can of Sprite and the gas release out,
Yeah.
And the reason why it's more of a in this can of Sprite is because the can is aluminum, whereas your bones are hollow, so you get more of the sound. And so understanding that, you understand then, okay, I can get an adjustment without any noise happening. Correct? If the body had that to the point where gas is now put in that misalignment, then you can actually get movement, which is the goal of the adjustment, is to actually get movement within the joint.
So you are never actually looking for the pop.
Correct.
You are just okay. Because a lot of people say, "Well, I went to the adjustment, I didn't hear any pop, so I don't think it'll work."
Correct. So the popping noise is an easy indicator for many of us who don't necessarily understand what's being looked for. And I say many of us because at once upon a time I didn't understand either. Getting adjusted, and I may have not heard a pop, and I'm like, well, I didn't hear anything. Anything happen? But the actual purpose is you want function or movement within the joint. If a joint was made to move and is stuck or fixated or restricted, then we got to get that joint to move. Now,
so based on that, is it true to say that louder the noise, it means that you were really in a bad shape because you actually accumulate that gas and now you release?
It can mean that, yes. If your body has been misaligned for a while and your body has adapted as it should, and you have that buildup of gas, that adjustment or that pop sound can be deeper or, like you said, louder in that standpoint. Correct.
Oh, that's awesome. I think that was the best part of the interview, because a lot of people have this misconception, myself included. So that's great. All right, doctor. Thank you very much for all the educational process throughout this conversation. I truly appreciate. Any final message to our listeners?
Hashtag get adjusted.
That's great. Love it. All right. Thank you, everyone, for watching another episode of Unleash Podcast. Stay tuned and see you next time.